Good evening from Hanover in Germany this evening. I'm making this recording and I'd like to thank the organisers and the International Federation of Dental Hygienists for really giving the opportunity to present to you all this evening. So I've entitled my presentation New Ways of Thinking and New Ways of Working, and you'll see as we unfold, I think the WHO resolution and many other things that have been happening over the last year have really opened up some new avenues for us to explore quite a change in the way we do general practice and also oral health generally. My name is Julian Fisher. I'm based at the Charité Hospital in Berlin with the Department of Oral Diagnostics, Digital Health and Health Services Policy and Economics. So thank you very much, and moving ahead. So really, I'm coming from this from an educational background. I'm currently giving a module to about 20 universities around the world on global oral health, as well as international organizations, including the International Federation of Dental Hygienists. And perhaps when we think of global oral health, we always think of it as being somewhere else than actually where we are. And I think what I've found over the last year about doing all this teaching is there are so many similarities. Even if you're in India or Peru or Scotland, we've all got some of the same challenges around oral health, and it's really the context. But as you'll see, there are some really new ideas of how we can start working and learning from each other. The idea, I suppose, behind all this is really to, and again, it's in the WHO resolution, to move towards a much more sustainable and resilient model of oral health services and care. And as the WHO resolution points out, it's really safe, uninterrupted services. Another thing that perhaps the presentation will give you is opening your eyes, broadening horizons of new career pathways and opportunities for lifelong learning. So I hope that as we go through the presentation today, it might give you some ideas of where you might want to go in your career. And I think, first of all, new ways of thinking. And I think that what we've got, in actual fact, is the social determinants acting as a pivot. We've talked about social determinants in oral health for a long time, but I think what's happened now is that we've got an opportunity to link together and connect all the things that we're actually already doing in a much more coherent and consistent way. And for me, the social determinants are the pivot, the glue that's going to start sticking what I'm sure Professor Nigel Pitts is talking about, and what Dr. Benoit Beren at the WHO is talking about. So again, the social determinants, as you will see, is a key element of bringing all this together. We've just had, obviously, a very exciting opportunity with oral health, with the WHO World Health Assembly approving the oral health resolution. So we're back on priority of the global oral health agenda. And while we tend to focus on oral health, the governments and WHO are really trying to make sure that what's in our oral health resolution is mirrored in other priorities this year. For instance, social determinants, there was a resolution on social determinants, and there are many overlaps and synergies between the two resolutions. Similarly, the resolution on the health workforce that went through this year in the World Health Assembly, a lot of synergies, a lot of connections between the oral health resolution and the health workforce ones. So the oral health resolution is not in isolation to what's going on around in the bigger health agenda, which means that we've got a really good chance of working with others to put oral health and some of the ideas that WHO is putting forward and will be taken up in their strategy and action plan. So very exciting time. And again, new ways of working. I'll come back to that point on the social determinants. In 2016, there was a very high-level meeting with the ILO, the WHO, and other organizations getting together with governments and saying, where do we want to go with the health workforce? Where do we want to go investing in health workforce to lead to employment and economic growth? And one of the key vision statements they have in that report, in that 2016 report, is the workforce should be geared towards social determinants. And that report has been taken into a 5-year action plan in 2018. If you go onto the WHO website, you can find that. And also there's a measuring device. So the National Health Workforce Accounts are by governments being able to then measure progress from where the this report has suggested that governments need to go, we've got an opportunity of and a way of measuring progress and any roadblocks. I think one for me, anyway, one of the most exciting things is we're framing oral health now in the Sustainable Development Goals. This is really putting oral health into the biggest arena, the biggest picture that we currently have, both in the health arena, but also in the wider Sustainable Development Agenda. And you can see almost the second, third paragraph is really calling out a couple of the 17 Sustainable Development Goals, 1, 2, 4, and 12, is saying these are very relevant to framing oral health and getting oral health onto these bigger agendas. And you can see on the little slide insert there, the Sustainable Development Report from India. So many countries are now orientating policy and strategy towards the Sustainable Development Goals. So it's great that we've framed the oral health resolution and what we're going to be doing into that bigger agenda. And this really provides us with a new narrative for oral health. We can now start linking the social determinants, but we can go further upstream to the Sustainable Development Goals, issues like planetary health and One Health, coming through, linking it into the body, and then obviously where we're focused on oral health and the microbiome and looking after the oral health of the person, but in a holistic, comprehensive way. And as your title of this conference is called, a total way. So really encompassing all those various elements. It's pushing that, if you like, that horizon, expanding those horizons to go right up to the sustainable development and into the Sustainable Development Agenda. So perhaps the conventional entry point for oral health was really focus on non-communicable diseases. And what we've now got with the Sustainable Development Goals, with this new resolution, is actually saying we belong and we have a role and an importance in many, many other target areas of SDG 3, and that's the one on health. And as you can see, you can go into SDG 3 and you can start looking at all those different areas that oral health has relevance, should be included. And for us, it's an opportunity to engage with people in many other health programs and services. Oral health over the life course, again, very nice in the WHO resolution on oral health, looking at maternal health and very young age interventions for oral health. And what we're seeing here, I've got a colleague, Rita Vilena in Peru, who actually starts seeing children all the way through from when the mother conceives, when they're born, and the child goes for oral health. I will keep you healthy rather than wait until you're 3 or 4 and then hope we've got no disease, because that's when all the key behavior patterns are formed. And she goes out into the community, right out. Let me see you in your living situation, get to know where you are, get to know some of the challenge that you face in your everyday life. So again, oral health begins at the very, very first moments of life. And again, coming back to the SDGs, it enables us, we've got diseases like NOMA, terrible, destructive disease of the face and the oral cavity. It cannot just be treated even within the health system. We need to go broader. And this is why having oral health positioned in the Sustainable Development Goals will allow us to move around other strategic areas for governments, talk about hunger, talk about poverty, talk about education, and really explain to people where oral health fits in. And there's a real move at the moment to have NOMA onto the neglected tropical disease agenda. And again, the WHO is really sort of reinforcing what we've all perhaps been wishing and hoping for many years, to balance the traditional curative approach with a much more preventative approach. So again, shifting from purely restorative to the preventative approach. And again, prevention in the biggest picture, as you'll see. So looking at the social determinants, understanding the factors that make people ill in the first place, and make sure that we don't just return them to their communities where they have slightly more challenging circumstances, and no matter how good our treatment, it will impact the way they can look after themselves. So we need to really reach out and understand people's social determinants. And if we look at the social determinants, you may think, oof, it's quite a big agenda, but I find that the mouth, just looking inside the mouth, you can almost see the social determinants just by looking at the way the teeth are arranged. People who have nice arches, nicely well-spaced teeth, good periodontal health, have fortunately good access to oral health care and services, and others perhaps who living in not so fortunate circumstances will have crowding, will have areas where decay perhaps gets in because there's not the possibility of keeping the mouth clean. And again, looking at the differential exposure, so sugar consumption, but going up to the social determinants, food safety, food availability, right up into food systems. So again, I feel there is a real opportunity with the social determinants to link what we do in the oral cavity right up to the bigger agenda. And again, the social gradient as well. You have to understand that if you're well educated, you're living in a nice area, you have financial reserves, you can look after yourself much better and offset any challenges. People that are living in very, very vulnerable circumstances will have a much harder situation and home life and a community situation. And you can relate those social determinants right up into the Sustainable Development Goals. So that allows us to do an analysis from the mouth, link it into the social determinants, and then start working with others in the community, but also at a national level, saying, well, we need to be at the table when we're talking about urban planning. We need to be at the table when we're talking about employment. So we have a wonderful opportunity through the social determinants to take the data and evidence we have and we collect in the mouth and really move that up into the bigger agenda that helps the patient and helps us do our job as well as we want to. And again, the WHO have got a very nice done by Sir Michael Marmot in the UK, looking at a model to explain the social determinants, been around for over 10 years, really getting another life with what we've seen with COVID. So a lot of interest around the social determinants. And you can see it's really important to have a look at those consequences of poor oral health and the inequalities of people's living circumstances. And again, the health system is so critically important down at the bottom. And when we're coming back to the social determinants, not only does it give us an opportunity to go into macro policy, into bigger policy areas outside health, because we need to address those sectors that, although they don't have direct relevance to health, their decisions impact the health of people and communities. And that is a lifelong learning process. So again, it enables us to start on a journey to understand, not just to have learning at the university or in our foundational years, but really see social determinants as a lifelong learning process, gathering experience throughout your working career. And again, absolutely critical, the link between oral health, and it's so good that the political declaration put oral health within universal health coverage, because we can see that getting to services, getting access to care, it's a universal problem, and oral health is a part of that effort to address that. And again, through the social determinants, we've got a really strong linkage between universal health coverage, the social determinants, and obviously the bigger agendas. And then when we're looking at perhaps the conditions that people live in, so the conditions that people are born in, they grow in, they learn, they work, they grow, and they age, those conditions have a huge impact on our health. 30 or 50% or more are actually due to the conditions of our living conditions, and what we actually do in our daily routine oral health care doesn't have that bigger impact. So that's another reason to start looking at the social determinants. And again, as we see this very nice model from Stockholm, all society and economy nestle within the environment. So we need to understand when we do oral health care, how much of the resources, the world's resources, are we using? How, when we talk about prevention, it's not only about disease prevention, but it's actually making sure that we don't damage and destroy the planet. So again, big agenda, but as you'll see, those issues have opened doors for us, but obviously things that we need to consider going forward. Environmental determinants of health, as I've said, a very, very big area. And if you look at those health topics, you can see chemical safety and climate change, really big issues where we have a really strong connection, as you'll see in the next couple of slides. So as you can see, we're starting to really get into the bigger agendas that will help us do our practice work. Minamata Convention on mercury, not directly related to oral health care, but related to dental amalgam. So the use of dental amalgam, 50% is mercury by weight, has been caught up in the Minamata Convention, and the countries decided that we need to phase down dental amalgam, and through that we've catalyzed change to start driving the shift to a more preventive, environmentally friendly model of care. At the same time, we're now starting to have the spotlight put on the alternative materials, so the resin-based composites and the glass ionomers. So we need to have a good, robust knowledge base to be able to tell our patients exactly what these materials do in terms of human health, but most importantly, the environmental aspects of the treatment and the care that we provide. Probably for me, that was, if you like, water pollution. We want to stop mercury getting out into the environment through the water, through our work. The other thing is planetary health. Water is a killer assumption. Like, we always assume that we're going to have water to be able to do restorative dental care. That may not always be the case. If you look at some of the data coming out, by 2050, 40% of the world's population will be living under areas of severe water stress. So again, that's another reason to move to prevention within a sort of holistic model of care, but understanding we need to start planning for those challenges ahead and having a look at all the things, all the processes and techniques and technologies we use to really minimize our footprint and to make sure that we can be sustainable and resilient for those challenges that are most likely coming down the line over the next decade. Again, climate change and oral health. The World Dental Federation is really now starting to look at climate change, oral health, migration, those bigger issues, and then relating it to obviously the oral health care of refugees. Huge population movement, migration through climate change, and oral health, a real critical issue in some of the refugee camps and with migrant populations. And we need to start showing that we have a social responsibility and we're accountable for those populations. And it's, as I say, the World Dental Federation really stepping up to the mark and doing some great work at starting those conversations with the bigger UN organizations and also with governments. And all this will require new competencies and skills. We can't perhaps remain with what we've got at the moment, particularly in terms of education. And there are needs to start looking at everyone having those competencies, not trying to give all the competencies an undergraduate degree, but seeing this part of a lifelong learning process so that people have the opportunity to communicate with populations about oral health, and also, as I was saying, within governments to make sure that those policies are optimal for oral health. So some really new skill sets that we perhaps need to be looking at in the coming years. And this is a long-term vision. This is not going to be the WHO resolution, and the ideas that it's bringing through are not going to happen overnight. These will be a sort of decade-long effort, but this will start coming in, and we need to be ready. So it's a fantastic opportunity today to really perhaps set out some ideas, particularly around the social determinants of health, because I do think that's our pivot, our fulcrum, and a way of bringing all these areas of work together in a consistent and coherent way. And just to let everyone know, there is a global oral health event at the Climate Change Conference happening on the 4th of November. Oral Health will have a day event. It will be live web broadcast, and we're going to have speakers on many of the topics that I've talked about today. So there's an opportunity with COP26, not only to learn about the event that we're going to be rolling out, but also understanding and learning about these interesting issues and interesting avenues for lifelong learning, for career opportunities, and just really being engaged in the bigger bigger agenda and learning where you can play a role, and also informing your patients, how oral health is changing. We've got a new narrative, and we're putting ourselves in that bigger agenda, and we relate to many of the issues that bigger society, and often our patients are concerned about: Fridays for Future, climate change, water. And I think that's going to help us create a new connection with our patients, showing that we're thinking big, we're looking at their oral health, and we have a role to play at a national level, at a global level, but also in communities. So with that, here are our social media channels. Very pleased if you want to engage with us. And most of all, to the organisers, thank you very much for inviting me. And I hope to see you in November at the Climate Change Conference. Thank you very much.